This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
So I was going to talk a little about a really boring topic, but a really interesting study that has implications for how we think about data. So obviously with mask wearing, there's strong public health initiatives that are generally not substantiated in prospective studies about mask wearing. The premise there is that we're protecting others and potentially protecting ourselves. There was a large study, the largest one to date, that was a randomized controlled trial called the DanMask trial. It was published in JAMA 1 week ago. And basically what they did was they studied in a randomized controlled manner whether or not mask wearing was protective for the wearer. You guys, have you heard this? Because it's a bit controversial. But basically they randomized, it was 6,024 patients to mask wearing or not mask wearing, and they followed them for several months, and the results were as follows. With mask wearing, 1.8% of the people got COVID. Without mask wearing, it was 2.1%. It was not statistically significant, and a lot of people used that data to justify the fact that, well, there's no really good evidence to say that mask wearing works. The problem with that is twofold. One is when you have a relatively rare event like that, 1.8 versus 2.1%, in absolute numbers, that's a low difference, but in relative numbers, it's almost 20% decrease. So the study, even though it was not statistically significant, when you have a negative result, it's called being underpowered to detect that effect. So the study wasn't large enough, perhaps, to detect that effect. The other big implication of that study is that it doesn't tell us whether or not you're protecting other people, which is sort of the bigger component. This just informs somewhat whether or not you're protecting yourself. So, it was published in a major medical journal. There's a lot of medical professionals that were upset that, it would be used in a distorted manner, which it has been. But, the nature of science is that sometimes negative studies get published, and if we understand the implications of the fact that it was underpowered to detect the relatively rare event, and we appreciate it in that context, and then don't use it to justify not wearing a mask to protect others, then we can understand that the science better. So it's a DanMask trial. It was published in the new JAMA, Journal of American Medical Association, and it was underpowered to detect something that was not, or that was distorted to be that, you shouldn't wear masks. So you may hear about it. Just keep people informed, because it's obviously still an immensely useful public health measure to wear masks to protect ourselves and others.
Thank you.
Cool?
Thanks.
Yeah.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.